UW Health Chief Quality Officer Dr. Jeff Pothoff is back with us tonight. Hi, Dr. Pothoff. Good to see you.
Hi, guys. Good to be here.
So do you think what's happening with baseball, what's your take on what that's showing us about the potential high school season?
Yeah, I think when we look at, Major League Baseball and these franchises that have tremendous resources compared to, say, a high school football team or basketball team, and we see them even struggling with this virus, I think it clearly paints a picture that, high school sports where we can't test people every day and we can't put them in their own bubble and lock them away might be exceedingly difficult to do in a safe way when virus numbers are high in our communities.
If they cancel the baseball season, because of this, I would assume other major league sports are in jeopardy as well.
Yeah, I think, if you're, an owner of a team or, you're part of the commission, you're really looking carefully at what we're seeing both with the NBA in Florida and with Major League Baseball, and really wondering, how are we going to do this safely when we've had a couple episodes already of teams having outbreaks. And I think, the Marlins are a great example of just how quickly this can spread. It's such a contagious virus that, before you know it, you have, double-digit team members and managers, staff positive before you really even know what hit.
It's such a tough call for parents, too, because things are still sort of trending in the wrong direction, aren't they?
Yeah, I think, in Dane County, we're seeing things flatten just a little bit. But when you look at Wisconsin as a whole, we're still trending in the wrong direction. And I think it's really difficult because there isn't a clear winning solution. We know, parents with their kids in schools or sports, that's clearly important, and there's great value in that. At the same time, no one wants to see their kids sick or infect other people like the school staff or their coaches. So we really are in just difficult times, just trying to make the best of, two not great options.
So the CDC, I believe, came out with something today called clusters, that doctors can look at symptoms and predict how bad a person's going to get sick.
Yeah, this is an interesting study, and it comes out of King's College in the United Kingdom. And what they did is they provided an app to patients who had COVID-19, and they monitored what symptoms patients had. And then they used these huge data sets. They crunched them with computers, and they found 6 symptom types. So not 6 different viruses, but 6 symptom types. And based on the type of symptom a patient fell into, they could predict the percent or how likely it would be that they would require, say, oxygen or a ventilator later on in their stay. So where this would be helpful is if you're a health system and you knew that patients fell into one of these symptom sets. Usually they can tell about 5 days into their symptoms that they might need a ventilator 8 days later. That would help you better prepare for what might be coming. So an interesting study, not yet peer-reviewed. It's going to be scrutinized by scientists. But interesting to see what we can do with computers and huge data sets right now to try to predict the future as to what will happen with patients who have COVID-19.
And 3 symptoms showed up in almost all the clusters.
Yeah, it was headache, loss of smell, and frequently cough, although there was some that didn't have cough.
Are we learning about new symptoms now, or have the symptoms remained relatively consistent for people who are COVID positive?
Yeah, we've added a few. I think, early on, we didn't think that GI symptoms or like abdominal pain or diarrhea were all that common. And as we've gone on, we've learned that there is a subset of people who will predominantly have some gastrointestinal or GI symptoms like diarrhea or stomach cramps. I would say that's something that we know more about now than we did earlier.
We seem to learn something new about this virus every day.
Sure seems like it, doesn't it?
It does. And a lot of people, I think, are getting a little weary, but it's as bad as it's been, right?
Yeah, I mean, back in March, I don't think any of us knew that this was going to be like an endurance race, to get under control. And it just wears people down, which we all understand. And it just really bears emphasizing those things, social distancing, mask wearing, hand hygiene. Those are the keys right now to get things a little bit more back to normal than what we're in right now.
Yeah, due diligence, that's for sure. All right, Doctor, we will talk to you again soon. Thanks for the update, and stay safe.
Great to see you, Dr. Pothoff. Thank you so much.
Have a good afternoon, guys.